Perfect.
And good morning, everyone, and welcome to the Speak Project. This is Speak Up with Tank and Lisa, and with me, as always, is my lovely co-host, Lisa. How are you today, Lisa?
I'm great. How are you, Tank?
I am good. You know, I can't actually hear my volume, so I hope this is the right time to actually start talking.
It is. I can hear you. You sound great. You don't sound demonic today like they had you yesterday.
No, I think it's a big plus when I don't sound demonic. You know, Doc, they, I don't know if you're familiar with frequencies, you know, healing or anything like that, you know, as a holistic practitioner.
Absolutely.
Okay. So what they do, right, is they will constantly manipulate my frequency and slow it down and try to, you know, make it so people don't listen. Which, when you hear me talking like Mem knock the devil, it's pretty easy not to listen, right? So,
Yep.
So when that happens, we have them log out and log back in, and it usually fixes it. So, yeah.
And so with us today, in addition to myself, who's Tank, by the way, we have the forensic nurse, Rachel. How you doing, Rachel?
I'm great. Thanks for having me.
So Rachel is our vaccine expert, and she is furiously recruiting out there, and came across Dr. Micahel Dym, who's been a veterinarian for 28 years. We clarified before the call, and he's going to educate us a little bit on how to identify when our pets are having reactions to vaccines. So, Doc, tell us about this a little bit. You know, what is your experience?
Well, my experience with this, Tank, is that basically the first thing I'll say is most human physicians, pediatricians and adult physicians, as well as veterinarians, know very little about what an immune or vaccine reaction is. So in other words, you know, many of us are familiar with, you know, the bee sting type reaction. You know, when someone's allergic to a bee sting, they swell up, they get hives, they can't breathe, their lymph nodes swell in their neck. And that's a reaction that if you're given a vaccine, I think even conventional docs and veterinarians will acknowledge. But there's a whole slew of other immune reactions that occur long after the patient leaves the exam room, sometimes hours or even days later or even months or years later. And immunologically speaking, we have data and evidence that actually document that. And of course, we see these animals in the clinic. So I see a lot of vaccine reactions, not just what people think is the rare case, which is where they swell up and get all the, you know, acute reactions right in front of us.
So, Doc, let me ask you about this. So, are vaccines that are created for animals, are they better researched than the vaccines that are actually created for humans?
To my knowledge, no, not really. And Rachel probably can comment more on that. But they're developed by the same major drug companies, and the research that goes into them actually, let me give you an example. Many years ago, Rachel probably is more familiar with this than I am, they came out with a Lyme vaccine for people, which was very important in Northeast, where I'm from. And they pulled that vaccine off the market as quick as possible because of, you know, people were getting neurological reactions and other reactions. With our animals, people have been using that Lyme vaccine, which is one of the most harmful vaccines out there, for years. And so the quality control and the safety standards have to be a lot less. Yes.
So give me some examples now, because you know, one of our big concerns and the way I see the vaccines, we interviewed somebody who was part of the MK Ultra program, right? And she was actually trained to basically be an assassin, right? And she said the most deadly blow that every assassin tries to master is the one that hits you, and then when you're far away from them, that's when they die, right? Now, that is really how I see the vaccines. They're a prolonged hit that's designed to mature in your body, adapt, and essentially degrade your health over time, so they can basically estimate, you know, an approximate lifespan. And I would imagine they do the same for animals as well.
Absolutely. Absolutely. I shared with Rachel last night an article written 20 years ago by one of the leading epidemiologists that studies the patterns of disease in animals, from 20 years ago, called Vaccine-Induced Autoimmunity in Dogs. And in that article, it talks about the animals developing antibodies against a lot of tissues in the body, our own connective tissues, our thyroid, the thyroid glands of the animals, even the animal's own DNA. And we see the results of those autoantibodies, as they're called, or immune antibodies against the body's own self, years later, months or years later. So you're exactly right with that analogy. Absolutely.
Wait, now, okay, Doc, I got to pause just for a minute because that was a pretty big drop, what you just said. I want to make sure I understood it correctly.
Mm-hmm.
You're saying that the vaccinations actually cause the animals, and this is documented, to have allergies within those parts of the body or to those parts of the body?
Well, to the connective tissue or to various endocrine systems in the body. So, for example, we cannot measure, I'm just kind of sidetracking for a second, we cannot measure a dog's thyroid function adequately, including, you know, when you measure a dog's thyroid function to see if they have a low thyroid, which is a very common hormonal disease in dogs, we can't even do that within the first 30 to 45 days after a rabies vaccine, because a significant percentage of dogs that are vaccinated with rabies will develop what are called autoantibodies, which meaning antibodies against their own thyroid tissue. And so not every one of those dogs will go on and develop low levels of thyroid hormone unless they're genetically susceptible. But it shows you that we can't even do the testing because you're going to get a false positive autoantibody, and then that dog might be diagnosed with a low thyroid. Hypothyroidism is a very major hormonal condition in dogs today. And it develops often, you know, in the months or years as a reaction to vaccination. We have the data that shows the antibodies against the body's own tissues, in this case, the thyroid gland. Yes.
Can I ask a question about that real quick?
Yeah.
Okay, so go back to the ingredients. If a human albumin is used in the ingredients and you inject a human albumin into the human, then we would make an antibody to that albumin. So the same thing for the pet vaccines. If it's made with Cocker Spaniel kidney or anything that has dog DNA, when you inject that into the dog, wouldn't you have an antibody to anything that's in there?
That's right. That's right. And in this article, Rachel, what it talks about in this article, they're documenting because of due to the bovine components in the dog vaccine. So yeah, which I know we're going to get together on and try and gather all the inserts and see what we can do.
So then that's that hemagglutination you're talking about. So anytime you add something to the body, the hemagglutination, the blood cells are going to stick together when you have, what exactly causes the hemagglutination with pets? I mean, that response. Is it that it's made with the pets, like dog DNA?
It's made with, well, I'm not sure I get the question. It's made with bovine.
Bovine.
Yeah, bovine cow. In this case, you know, in this article, it's made with the bovine, you know, he's saying albumin, but bovine albumin in this particular case.
And
so
they're having a reaction.
They're having an immune reaction to it. And as a side reaction, you know, it's reacting against these various connective tissues in the body and the endocrine systems. So I have to do a little more research on the exact immunology of the reactions, but these things have been documented, Rachel. They have been
right. And then the Cocker Spaniel kidney, we know they used in one of the vaccines, or it's like a growth medium. So if you're adding DNA from the same species, then you would again have that reaction of attacking
cross reaction. Yes. So
wow, that is incredible. We're going to pause for 1 second. All right. So, Doc, I want to make sure that I understand the principle that you just described. So you're saying that the vaccines, based on the research, what this doctor showed, Dr. Glickman, it showed that over time he was following the biological changes, right? Or the physiological changes in the body. Right. And over time, it actually, the animal developed an allergy to its own body, right?
That's right.
Now, that's something I've heard about that before, because I know that a lot of times there's meat. If we eat too much meat, our body has to create a parasite to actually digest it. And essentially it starts to devour us eventually. It's kind of how it works, right? So would that be considered an allergic reaction, something like that?
Yes, that's a good analogy, yes. Mm-hmm.
Okay.
And, you know, these reactions, like we were outlining, are, you know, and for my colleagues, I want to just make this point. It's really important. For any regular conventional doc, pediatrician, veterinarian who just thinks they're doing no harm, you know, basically there are 4 phases of the immune response. Type 1, with a reaction, which is like the bee sting reaction. That's immediate. You know, anybody who's allergic to bees, you know, knows what that is. And then there's type 2, 3, and 4. And those are the reactions that we're seeing in the clinic, and that we've documented many of them biochemically in certain studies. And so when people say vaccines cause no reactions, they're just looking at them in the exam room. They're not looking at them, hours, days, weeks, months later. That's what we have to be doing, in these situations.
That's incredible. So, I mean, no, that is the truth too. I mean, everything about this is
and it's Immunology 101. That's what it is. Immunology 101.
Right. So this is actually saying here, now I'm going to pull it up properly here, is that this actually says in this study that you're witnessing these changes in the dogs that were vaccinated, but not in the regular dogs. So here I'm going to highlight it better with this. So right here, right, you have a whole piece. Vaccinated, but not the non-vaccinated dogs in the produced studies developed autoantibodies to many of their own biochemicals, including fibroconnectin, laminin. I'm not sure. That would be the connective tissues, right? DNA, right. Albumin, right?
Yep. Cytochrome C.
Wow. So this is all our connective tissue. So this would really potentially, Rachel, if I understood you correctly, could this potentially be the reason why we have like early onset aging and joint aches and things like that?
Everything. And when the cytochrome C, Doc, is that a liver enzyme?
Yes. Mm-hmm.
Okay, so you're basically destroying the entire body from the inside out. But one key thing I wanted to ask the doc, how do we document this stuff? So my dog presented with fungal infections, constant fungal infections that would come back, getting to identify that with the vaccine. How do we document all of that?
It's hard to document, Rachel, because there aren't any other than the only, tests we can do. There's a lot of chronic diseases that we see that are augmented by vaccines. So for example, with a skin and a yeast infection, we don't really have any sort of specific test or antibody test or that kind of thing. But I will tell you though that, and this is another study, Tank, that you can maybe pull up a little later. Many years ago, there was a study done by a guy, if you look, it's a guy named Dr. Frick, F-R-I-C-K, and a couple of others. And it's on the allergic reaction to pollens in dogs is significantly increased by what we call polyvalent vaccines, sort of the MMR vaccine of dogs. So what I mean by that is that when dogs are given a typical yearly MMR or DHPP as it's called, or distemper parvo combination vaccine, they will actually have an enhanced antibody response to pollens and dander and molds and ragweed. The dermatologists, the conventional ones, know this. And so the number one thing we see in the clinics, Rachel, is allergic dermatitis, which is where dogs are scratching, chewing, biting themselves, recurring ear infections, and then what they get is a secondary yeast, which is what you're asking about, bacterial infections, yeast.
Mm-hmm. And this is the key point I want to point out to people. Yeah. When your pet presents with the paw licking and the allergies and the sensitivity to food, I'm relating all of those things, all of them, back to the vaccine, because I watched it happen in my own dog. So those are the things to look for, and we kept bringing her into the vet with the ear infection, the fungal infection. But my point was it's all related to the vaccine.
It is all that. And Rachel, when she asked me to come on this program today, maybe we'll have some time to go into it later, I pulled up 2 cases that I had this past year just from a local Humane Society rescue place I worked at just transiently. I couldn't take it any further because of all the vaccines. But what I saw, just to show you what these vaccines can do, these were animals that developed severe neurological reactions within a few weeks of their vaccines. In one case, the cat stabilized, and as long as it wasn't given any further vaccines, and in the other case, the dog developed symptoms of chronic, odd neurologic things. They didn't progress either. Thankfully, these clients elected not to vaccinate their animals any further, but these were 2 crippled animals, in one case a dog, one case a cat. I have both the case histories right here. Both were clinically normal, both within a few weeks of the vaccines. They were clinically normal for months in their whole lives. Within a few weeks of the vaccines, both of them developed severe changes that the neurologists were stumped with. It's just really, this goes on every day across this country.
So Doc, what does that look like, if you could describe? So, this is just an amazing phenomenon about people, our attachment to our pets and our animals and the love we have. And as a matter of fact, people will know that kids in their own neighborhood are homeless and they'll still raise money for pets, you know, in Uganda or something.
Yeah.
Which is always, you know, now I love animals, but not like that, right?
Right.
So
right.
but it's a fascinating thing to me. So in the vein of getting people's attention to realize, now, if this is happening, how would you recognize neurological disorders with a cat or a dog? I mean, they have to be pretty severe, I would imagine.
Well, yeah, in this one case, the kitty, and probably Rachel could comment maybe on a metaphor what would happen in the human infant, but this kitten was actually given, was an adoptee from the street. A lot of these rescue organizations, they do a beautiful job. They take these kittens in, these puppies, and their hearts are in the right place. But you know what then I say? Stay out of healthcare, you know, because then what they do is they just bombard them with all these vaccines. They spay and neuter them when they're little, before their bodies have a chance to grow. And then they're giving them these poisons topically, internally. And then they're saying here to the public, you know, give this homeless animal a home. And then what's happening is these people are getting these animals and they have these horrific diseases. So in this case, this little kitten had a little bit of diarrhea when it was a few weeks old. And it was, you know, treated appropriately, conventionally. And then it got its vaccine. It was doing well. And then it's got its vaccines at 5 or 6 months of age. And within a couple of weeks, within a week or two of the vaccines, the owners noticed the cat started having weakness, tremors. It couldn't get in and out of the litter box. So it was quite pronounced, you know, quite pronounced. Yeah.
Doctor, I have a question. What vaccinations are they recommending to dogs and cats? Which ones can people get out of or opt out of? That kind of thing. If you could, enlighten us on that a little bit.
My role in my holistic practice is I consider myself the word doctor means teacher. So what I try and do is give people
my own heart right there. That's right, Doc. I
tell
it all the time.
Tank says that all the time.
And I give information and let people make informed decisions. So I know with the human side of things, with my own children, I made my own decisions on vaccines, and which was Zippo, but with their clients, so there are certain core vaccines that people could consider when they're susceptible to them. So the two main core viruses in doggy land is one called parvo and distemper. The truth of and distemper is related to measles, which is another discussion. But those two core viruses, most puppies, if they're going to be dogs, if they're going to be susceptible, it's going to be under high stress conditions, poor stress, poor hygiene, poor nutrition, and when they're under a year of age. So the truth of the matter is that if a client decided to vaccinate for these things, when they get it when they're younger, the immunity lasts for years, if not their whole life. And then if their animal's over a year of age, they're not clinically susceptible to parvo or distemper. Yet most veterinary practices in this country are giving, yearly. They've cut down a little bit to every 3 years, but they're still over-vaccinating these animals, and they just don't need them after their puppyhood, other than rabies maybe is required by law. That's really and then there's ways of, we'll talk about how, clients who have immune damaged animals can potentially, avoid that one also.
But that's the problem. That rabies one in particular, I found it was a year and 4 months after they pretty much killed her with it. So they pushed it on us. They, so you have to have this, and they're pressuring people.
I know. It's really, I've seen more reactions to rabies vaccine. Rabies vaccine causes more problems with the nervous systems of dogs, behaviorally, anxiety, aggression, problems with the lower legs, all sorts of autoimmune issues of the facial structures. I just did a consult this week with a client that had a dog who developed an autoimmune disease where it can't open its mouth. It's called myositis, and it was right after the rabies vaccine. So these things, they affect the nervous system. And again, it's months or years later. Little dachshunds they develop more paralysis or pain or trouble getting around often after the vaccines, because a lot of these degenerative spinal cord diseases that we don't know the cause of in Western medicine have an autoantibody, component to it. And no matter where you put no matter what you call it, it depends upon where in the body the autoantibodies are directed. If it's the spinal area, then you're going to get your MS, you're going to get your, degenerative spinal conditions, what's called degenerative myelopathy in German Shepherds, dachshunds with lower back problems and disc issues. You get a turning on of the genetics to manifest their clinical conditions, or you cause mutations in the DNA and get new diseases. That's the other component of what vaccines do that my colleague Patricia Jordan talks about all the time. So there's a lot of information on this, and I've seen it in the clinics over several decades in very busy clinics.
That's what happened to my dog. Yeah. She got up, the cancer lump formed on the neck, after the rabies vaccine. Then she stood up and she was kind of frozen. The legs wouldn't move in the back. And I said, this is neurological. And I knew all along. Right.
And then and unless that's treated, that animal's not treated with deep medicines, detoxified, treated appropriately, you're not going to be able to help that animal. Unless the old standby prednisone and antibiotics, that's all we throw at these animals, muscle relaxants. It doesn't get at the cause of it.
But they put the families through hell. And that's the thing that I don't like. I don't want to see any more families go through hell like what I went through.
Well, it's Rachel, the two cases I brought up here. The other case was a dog who developed, literally looked like an MS in a puppy after it's 6 months of age. It didn't progress, but these two people went to neurologists, spent thousands of dollars locally here. The neurologist says, we don't know what the cause is. It could be a genetic thing and this, that, a toxin, everybody's making money, and these poor animals are made sick, and the clients have crippled animals, and they're heartbroken. I mean, I see this all the time. It's tragic.
So let me throw this. Oh, go ahead. Okay, go ahead.
I wanted to say, doctors, so in Rachel's situation, or actually anybody taking their pet, what could they say to their veterinarian that would be, look, doc, I think that maybe my pet has been vaccine injured and I don't want any more rabies. Like what do they need to do in order for that to happen?
Well, we certainly as licensed veterinarians need to follow our state laws. If we're licensed veterinarians, so we can't tell them that, not to get the rabies vaccine, but many states in increasing numbers allow for medical exemptions from rabies. There's also more and more states that are, well, not too many, but a few honor what are called rabies titers as an alternative. Not many, but a lot of them will allow medical exemptions. For example, where I was from in New York, New Jersey, Florida here, they allow, if a veterinarian feels that an animal can be at risk from being vaccinated, they can write a legal medical exemption and you're not breaking the law. And for the people to learn more about that, you can go to a website, rabieschallengefund.org, and that's all one word, Rabies Challenge Fund. And they list, some of this information, how long immunity lasts to rabies vaccine, which is now being studied to last many, many years, as well as certain states that allow medical exemptions. So I would encourage the audience to look on that website to see if their state is listed there.
Okay, thank you. Appreciate that.
So I want to have this discussion because this is really important stuff. And obviously, humans and animals, we're different, but I mean, our bodies have a lot of similar functions, right? So a lot of things that we see in the animals, we could reasonably expect to see in humans. That's why we do experiments first on animals, right?
Right.
So now the doctors I talk to a lot of holistic physicians, a lot of medical doctors, and all types of healers from all over the world in every walk of life, from energy healers to, chiropractors to shaman witch doctors. And I haven't really talked to shaman witch doctors, but you get the idea, right? So now in all this, I have calculated all of the collective information, and everything in everybody's body, including animals, comes down to these three things. It's misalignment, inflammation, and malnutrition. And
love it. I gotta write that one down.
So if you have spinal misalignment, it disrupts the ability of the nervous system to heal the body naturally. And like Dr. Dym just said, doctors are teachers, right? So if you understand, look, you're out of alignment, we can heal you. In reality, though, Doc, right? The body heals itself, right?
Exactly.
That's what we're teaching. The body will heal itself if it is in alignment, right? And because what happens is when there's misalignment, one part of the body starts to malfunction. And because there's not enough nutrition in the food that we're eating, the body doesn't have the ability to, kind of patch everything together to heal it.
Right.
And inevitably, it causes some kind of blockage somewhere, right? You're on a microvascular level. Now, this is what I don't know if you've ever heard this. Have you ever heard, now there's a research study out there on human vaccines, but I'm definitely, after hearing what you're talking about, it definitely applies to the animal vaccines. And the study says that vaccines are causing micro strokes, these tiny little strokes in the body. And this would inevitably, pass through the bloodstream, right? and either, collect mass. I'm not sure exactly what would happen, but eventually the things you're describing, you could easily, it wouldn't make sense for a child to have a stroke or a puppy, but that it would kind of manifest the same way, right? Like, it
does. Yeah. That's kind of what happened with this. That's funny. So this neurologist really did an MRI on this cat. And I think the MRI report, it's very interesting. It was a cerebellar lesion that, was a sudden lesion. That's why they think maybe it's a trauma and injury. No, it could have been a stroke triggered by, of course, the vaccine onslaught that the kitten had, because it was clinically normal the first several months of life, other than having the diarrhea and the leaky gut as a kitten.
Wait, so they call that, what's the word for it though? The meningitis, when the meninges swell, their crafty language that they call it something else, right? What's the term?
Yeah, I'm going to pull it up here because I had it right next to me here. This was where's her report? Oh, okay. Well, basically, I don't have her exact MRI report, but she said that basically this kitten, what did she call it here? She suspects, the MRI shows a loss of normal cerebellar detail in the fala and possibly some subtle changes in the advanced brainstem. CFS analysis was very normal, and urine organic acid screen was also normal. She was checking for inborn, genetic congenital diseases. So this cat had developed tremors, to progress to weakness in the back end, and this was all following the vaccine. And she writes here, we're trying to slow the progression of a suspected degenerative brain disease. And in the last few weeks, the cat's case has gotten worse in spite of the steroids. And she said, when it's time, you might have to put her to sleep. Well, it somehow the body did stabilize itself. I don't think she was doing any holistic work or other work. And 2 years later, she came in and she said, Doc, should I get the vaccine? I didn't know this woman back in 2016. And I wasn't at this clinic. And I said to her, absolutely not. I said, here this neurologist was giving your cat a death sentence, and 2.5 years later, at least the body found the wisdom to stabilize itself with. And I bet you if she got any more vaccines, that cat would have been a goner. But at least she was a happy cat. She was a handicapped cat. But, and the neurologist doesn't mention a thing about the vaccines. That's the crime also. That's a real big crime. And the neurology people aren't, even mentioning that. The board certified veterinary neurologist, much the same way I'm sure Rachel will say with the human neurologist.
So I have a question about this too. So this is always like you go into any Western medicine, right? They're going to say, what's your family history of X, Y, and Z, right? And they're looking for some kind of genetic anomaly that's true with your family and now mine and so on, right? Now, I really want that to be challenged, right? Because in 1950, everybody before 1950 didn't have a lot of the major issues. Everyone had perfect teeth. There wasn't teeth breaking down and cavities, and there wasn't a lot of these issues because in 1950 they introduced antibiotics.
Right.
So you introduce antibiotics, and the guy who invented them said these are toxic. Never take them, right? Unless it was like very urgent, right?
Right.
So now you take something like antibiotics. Now that generation really got hit hard, right? And that initial round of antibiotics, but their offspring actually adapted. So by the time the next generation came and they got the same antibiotics, they were more equipped to deal with it. So the idea that the genetics is actually, like a fault, right? Like, oh, you have a genetic history of this. I think the body actually adjusts. It actually gets better. So I think that is something that is looked at too carefully. And we should look at more, look, the body should have made adjustments. What is the environmental hazard, like, outside force that is disrupting the body's natural ability to heal itself?
Right.
That kind of seems what's happening with the cats too.
Yeah, well, the cat and the dog. Now, what my colleague Gene Dodds talks about is there's a allergy threshold. Let's just use that term allergy for meaning an excessive immune response that causes clinical disease. So let's say you have a dog who's allergic to certain proteins in the food, pollens in the air, this, that. They're getting flea drops on their back, and along comes the vaccine. Each of those stressors, Tank, is raising that dog's, reactivity until it reaches a certain threshold. And then boom, then you show the symptoms. So that's why we want to look at everything holistically. We want to look at what we put in the body, on the body, what we inject in it. Well, and that's what we're doing to these animals. We're giving them all these shots. We're giving them lousy foods. We're poisoning them with pesticides on their back and internally. And, you know, the time has come for people to get wind of this and to understand that we have sicker animals today at younger and younger ages, cancer, all these autoimmune inflammatory conditions. And, you know, that's what my passion, you know, the next part of my life is, to get that information out there to people. Yeah.
Nice.
So now this is something I think is really dangerous right now. So Western medicine, now this long time ago, I was a diabetes care specialist. I called on this doctor, Dr. Goldstein. He's one of the foremost thought leaders in the world in GI issues. And in that practice, what he told me was this, how almost every GI, right, like gut doctors, right, like gastrointestinal doctors, what they all did is they looked at, you know, the mouth, the throat, the stomach, the intestines, the colon as separate.
Oh, wow. I'm glad you brought that up.
Now, this is such a ridiculous idea to me, right? You have this even flow through that goes through your body, right? And connects to everything else as well, right? But what he said was this, he said, now people would come in with terrible reflux, right? So they'd give them these proton pump inhibitors like Nexium or something, right?
Oh.
And which is terrible, right? Because it's killing
even in animals and horses and dogs, yes.
Right. And then actually the body reacts when you take them off Nexium, it like overproduces these little proton pumps, right?
Yeah.
And he said all he would do is give them like some kind of a stool softener, right? Because the people that had acid reflux also had like constipation of some sort.
Constipation.
If you treat the constipation, it treated the acid reflux. Now, that's more of a holistic approach, right? He was, in his world, he was a genius for figuring this out, right? Like, they're like, what? And I'm like, are you kidding me? Of course, that's what anybody can look at the body and see that's how it works.
Well, ridiculous. Yeah. Well, with our cats, we have that. So with kitty cats, they have dogs get it less commonly. They develop autoimmunity on the lining of their gums. And we call that, and it's got a fancy term, lymphocytic, plasmacytic, which means all the cells of the immune system, gingivitis and stomatitis. And I found, and a lot of us who do holistic medicine, the cats that are getting the vaccines, all of a sudden their gums will get real red. Some of them will develop ulcers in their mouth, and boom, there you go. You have animals that are now having autoimmune disease. So if you biopsy the gums of those cats, it's the exact same disease that occurs down in their lower gut, in their stomach and small bowel, that we then later call inflammatory bowel disease. It's one similar tube, mouth to anus, like you just said. And we have that clinically. We see that in the kitty, especially when we have these cats with gingivitis. And a lot of those cats have inflammatory bowel disease because they have autoantibodies throughout their gut or throughout in their mouth, and then they manifest the same tendency deeper. So we have the same stuff that goes on in vet medicine. Absolutely.
Rachel, drop it. I know you're chomping at the bit, girl. Go ahead.
No, it's good. So would it be in the brain too then? So all the plaque buildup in the whole vascular system.
Absolutely.
Because basically, anytime if you have plaque in the vessels, you're looking at bacteria. Okay, always. So it would be systemic then, the entire vascular system. Wow, that is so profound. I mean, but you know what? We really arm the people with the knowledge like this, and then when they go into the vet, how do we prepare them so that they can not be bullied and speak with confidence about this issue?
Right.
Well, hopefully with this show and other information, we can educate people. You have to really just give the people information. Unfortunately, the mind control, brainwashing techniques of young veterinarians and veterinary students, and I'm sure young physicians, is amping up. So these people that are graduating, I'm not impressed. They don't really think on their own. They follow an automaton approach. They're not even teaching about vaccine issues in medical school and veterinary school. So all we can do, Rachel, is just like you're doing, like I'm trying to do, is arm people, give people the information, keep talking about the facts, keep bringing up the Glickmans and the other people that are Wakefields or whoever that have bravely stood out, and obviously Glickman at one time 20 years ago. But these are things that we need to be aware of and give it to our clients, publish it, put it on our Facebook, our websites, and just, try to make a difference one client at a time, right?
Yeah.
Okay, so I'm going to give some solutions, right? Because these things it's a big deal, right? So we're working actively with people all over the world right now. We do know for a fact that we have frequencies that can be played in your office And in practice, you know, with Rachel's doing all types of holistic, amazing things, right? That you could just play and they will you can, if you give those to people or sell them or whatever you do, right? They will literally reverse the effects and undo the effects caused by the vaccines. That's one.
That's great.
But for more immediate, you know, because people, one of the problems I see is, like you said, people don't want to heal themselves. They want you to heal them, right? So they want like this supercharged pharmaceutical, right? Which is like a molecule on crack, right? It's like on steroids, and it's like taking somebody's one arm and making it, you know, like Arnold Schwarzenegger, and the rest of their body is like a 5-year-old, right? It doesn't work. It's going to cause imbalance. It's going to cause problems. So this is a little more of an acute. I actually saw this work with humans. I've seen it work on animals amazingly. I've seen it heal animals. Is the Beamer. I don't know if you're familiar with the Beamer at all.
Yeah, one of my colleagues was a big fan of that. Yeah, I had it done. I went for a demo when I was at a meeting, and I didn't buy one, but you know, I did see about the Beamer. Yeah.
You know, I got to tell you, I don't work for them or sell anything, the products, and I'm very big on, you know, that's why we don't sell products, so that when we endorse something, you can trust, like, we're not selling it, you know. So, but the Beamer is amazing because I've watched it. There's incredible videos on this. It's been around for a long time. Yes. And the only reason why they've been allowed to survive is because they're so low key. You know, so for anybody who doesn't know, it's just basically like a mat that literally it taps into the energetic field and restores the energetic field of the body, and it will break through the microvascular buildup that happens all over our body, which causes, you know, like for diabetics, you know, like the neuropathy that happens, or which is the same is going to happen with animals. Right. But I'll bet you, based on what you're describing, I bet you it traces back to blockages somewhere in the body, in the, you know, in the network of the neurons that you can't really treat any other way.
Right. No, I don't have any clinical experience with the Beamer, but I've heard good things about it. Yes.
Yeah. I mean, I'm always trying to think of how to do this, right? Because
I use in my practice. I know this might be I know you've heard of it, but it's very powerful. You know, the old adage, less is more. But vaccinosis, as I call it as a homeopath, is, I find, even sometimes just simple energy medicines matched to the symptom totality of the patient slowly or even quickly sometimes restores health and balance and removes that energetic and starts healing at that deeper level. And then we come in with our functional medicine, our healing the leaky gut and all that, and all the ways we do that. So I think you could look at healing in many, like you're saying, in many layers. And I try to do it from an energetic perspective. And of course, I try to do it from a functional medicine perspective.
There is a homeopathic laser detox that Dr. Cowden is famous for, but you can do it with pets too. You probably, you know about the laser light with the homeopathic, and you're basically shining it on the human body or the pet, and you're getting it to release that virus, release that metal.
Interesting.
But there's a whole bunch of ways to detox. But anyway, the laser homeopathic one is very sophisticated.
Yeah. And the bottom line, Rachel, is it's prevention in our world. It's like, just, you know, the past few weeks I've had it's been so nice for me to see just clients come to my home office with their young puppies and kittens, and we don't want to do it that way. And it's like, thank you. But I also tell them, because we're doing it, we've done it to them for generations. Don't be kind of upset if your animal starts having a little bit of an ear issue or a urinary issue, because generationally, we've destroyed ourselves. I mean, we've really done some pretty bad stuff to ourselves. So children and both animals are born today already with the errors of the past generation. So, for example, I see animals that are born from the effects of rabies vaccine, even if they haven't been vaccinated, as young dogs sometimes. So that's pretty wild stuff. It's epigenetic, really, beyond genes.
Oh. Hey, Rachel,
so it's genetically coming from their parents.
That's right. Energetically, miasmatically, as we say in that.
Corrupted DNA.
Yeah, corrupted DNA.
Exactly.
Sure. Mm-hmm.
Okay.
So now here's something I feel like needs to be talked about more, though, is our DNA can correct itself, right? Yeah. That's something that people don't realize. I think DNA is permanent. You can't change it. This is how you are.
Oh, it can correct.
But it can work.
Yeah, you can heal the DNA. Oils heal the DNA. Many different things heal the DNA. Cannabis heals DNA.
Wow, good stuff.
That's right. Yeah.
When you say oils, you're referring to essential oils?
Essential oils, yeah.
Yeah, that's what I thought. Okay, just making sure. Yep.
Rachel,
yes, particularly the ones that break the brain-blood barrier.
And the other thing we have to keep in mind, guys, is a lot of people are into a lot of these great therapies, but then all of a sudden they'll just go to their doctor or they'll go to the pet store and they'll buy like these pesticides, and then boom, if that, if it's a susceptible animal, you're doing all this good stuff. You can't go back to the stuff that made them sick. That's the key too. So if you go back to vaccinating them, and if you go back to putting flea and tick medicines and heartworm pesticides into these animals, you're going to end up with, again, chronically sick animals. Even if you're doing all this great stuff. Yeah, poor diet. Mm-hmm. Yeah. Mm-hmm. Yeah. Everybody thinks there's one magic bullet. I have clients that come into my practice. Oh, I tried the raw diet. It doesn't work. I said, it's not the only thing. Sometimes it makes a huge difference in a dog or a cat where it heals most of the issues. Yeah. We're all each individuals, so are animals. Yeah.
So one of our nutritional experts actually talked about this, his genius friend, who is a mysterious person we don't know, but he talked about it. And he said he did these experiments, and he actually showed that nobody's allergic to bread. No one's allergic. The allergies to food are not real. What's the allergy is these synthetic things they're putting on the food, right? Even organic food has to be sprayed. When it travels, the organic food from Mexico, I'm like, it's no longer organic by the time it gets here, and I believe that. And I have actually witnessed that in people who developed hypersensitivity to all these things, later in life. Like,
so funny you say that, because I just saw a friend of mine send me something about now they have that information on the carcinogenic effects of the scented laundry stuff, or your clothes, or the list goes on and on, right?
They just use that as a selling term, to kill one product and build up another.
I know.
Every cancer comes and goes in the body constantly.
That's true. Good point.
Yeah, it's like everybody has cancerous cells. Your body you can actually see this.
And we have natural killer cells.
Go in on it and just beat it up.
Right. We have natural. I was just going to say we have natural killer cells that keep those cancer cells in check. That's an excellent point. It's when it gets out of balance, and boom. That's why we have to avoid all these stressors.
Yeah, I don't believe in avoiding. I mean, I guess like things if we're putting poison in our body, but I feel like people are built to adapt and perform, and like that, like in this environment, one of the things I think is really feels very tragic and scary for people is they start to look at themselves as, I was damaged by vaccines, and that's it, right? And I really think it's important that we start talking about solutions while we're fighting the legal side of it, which Absolutely. We are. Like we're challenging that, but this is genocide. They're literally putting these things and planting these long-term controlled life sentences on us, right? And they say this from cradle to the grave, it's eugenics. So that's a real conversation that people need to start having. And they do it with the animals as well. And a lot of times they're probably just experimenting, and it makes money, as long as it makes money. But I think the myth that people embrace is that it's about the money. It's not about the money. Yeah. It's about control.
Look at
vaccines. It's about control. I love that. You're right. It's about ego. You're right, Tank. Ego and control.
Yeah.
Well, vaccine-induced distemper. I remember someone saying my pet got vaccine-induced. So this is engineered. I call it a manufactured outbreak, because if you're we're basically injecting disease into our pets. I mean, let's talk the truth. That's what we're doing. So you're injecting them with disease, and then they're sick, and then we're like, oh, how'd this happen?
Yeah, true, Rachel.
Isn't one of the side effects of the MMR vaccine the measles? Isn't like when that because I mean, shouldn't that be included in the PI, right? Like, hey, one of the things that might happen when you take the MMR vaccine, the mumps, measles, and rubella, you might get the measles, right?
Well, you know what, hey, Tank, let me just, so I said earlier about distemper being a measles virus. That's one of the core viral vaccines we give dogs. So when puppies are getting their vaccines, you know what they're getting on their belly? We call it a puppy pyoderma. And what that means in English is little measly eruptions. That's the body discharging the toxin, having little mild distemper from the
right.
vaccine. Exactly.
All this stuff, And what they did, we actually talked to Dr. Reem about this, and she was explaining how when they set the nutritional guidelines, which I'm sure they did this, they might not have done it for animals because, there's not as much of a hatred towards, animals as there is towards humans, right? But when they set the nutritional guidelines, they identified, okay, this is what people need to survive. Mm-hmm. And then they put them just below that. Right? Which is kind of like, wait, we identified this line as survival. Why are you below it, right? And then they remember the food pyramid used to be the most ridiculous thing in the world.
Absolutely, I remember. Yeah.
It was like how long before you think they'll catch on, right? Like we're gonna put it here that you have to have 9 servings of bread a day, things like that, and milk,
right? Filled with hormones and milk and bread, just full of hormones and pesticides and everything else in your body.
And the processed pet foods are the same thing. The minimum levels of the feeding trials just to survive, not to thrive, to survive during the feeding trial. That's how they come up with commercial processed pet foods.
And we did the prescription diet when she had all the allergies, and they were no better, the foods, and they ran us through the rigmarole. So what does vaccine detox for a pet look like, though? I mean, is that something we want to stay away from, or?
Well, it should be done by a holistic, that's the thing. And look, I was going to post something about this, but I understand where this information is very hard to come by. And I understand the desire and need to reach out to social media.
Doc, we can't hear you. We lost you.
Yeah, you lost me?
Just for a second.
All right. So you've seen about we need to treat these patients with skilled holistic nurses and physicians and veterinarians. You have to be careful not to get all your advice on social media, on chat rooms and this and that, because these bodies have pathologies in them. And if you don't have a doctor or a nurse who can, monitor that, or a skilled practitioner, that understands how disease and pathology work in the body, then you could do more harm. And that's the only thing I get concerned about with a lot of what I'm seeing in the social media land is a lot of these chat rooms, people getting advice from other people, and they're trying to find out all the answers they can, but you still need someone in the saddle, so to speak. You need a Rachel. You need a holistic veterinarian or a holistic doctor to guide, the process. Otherwise, the person or animal can get sicker. So Rachel, what I do in veterinary medicine is I definitely do like a heavy metal. I put animals on chlorella and spirulina, and we detox the liver. We do all those kind of things. And then I treat the animal with homeopathy. That's my way of treating it, with energy medicines. Obviously, Tank's brought up the Beamer, which I haven't used yet. And there are other ways, the frequency, ways you're talking about. So I think, there's a lot of different ways of doing it, but I would encourage everybody just to, seek out someone who's trained, skilled, who has experience on both sides of the aisle, so to speak, and can really, guide the treatment, not just on a chat room on Facebook.
Right.
Yeah.
Right. Good point.
Hey, Doc, I would love to set up a page for you on the Speak Project. Now, we have some of the most holistic, incredible people in the world that watch what we do. And I would love to be able to, share some of the things that you advise. And also, I think it's a good point. At some point, you need to find someone like you. But you know what? I'm in New York. I couldn't tell you where a holistic veterinarian is anywhere.
Right,
I wouldn't know where that is. Now, to be
honest,
the
other thing you have to keep in mind is there's also, when you say about, let's use the term snake oiling, there's more and more even conventional vets or doctors or poorly trained ones that are saying, hey, I'm holistic, because they want to get in on the money and the dollars and this and that. You want to go to a vet who takes active training, who comes to or a doctor or a nurse who belongs to organizations, is well-read, is keeping up on the current, kind of cases and conferences. And so there are certain standards. I work with people over the phone. I do some lectures here at Hippocrates Health Institute here in West Palm Beach, and clients are from all over the world. We Skype, we talk, and so I do work with a lot of people. And so, if they're not in your immediate area, you can do phone, Skype, work on Zoom, that kind of thing.
Doc, I like that. But when you say that, and all of a sudden our people start calling you by the hundreds, so I'd love to be able to help you with that. I like what you're looking at. I like the research that you're talking about, and I love to hear intelligent, caring doctors and just practitioners in general, right? Like, I love the way Rachel is. Like, she's got solutions. And this is the biggest issue I have with all of these, awareness people. It is not enough to be aware of these things. Awareness is useless if you do nothing. Now, here is the big fraud, right? People get up and they say, vaccines are bad, and they're speaking in front of Congress. And so everybody sits back and goes, oh, they got it. No problem. Thank goodness somebody's talking about it. You know what happens? Nothing. If we don't challenge these things and actually bring out, here are real solutions you can apply, they work, right? And put our brand on it, our name on it, and say, this I know works. Like, I know I've seen frequencies work on everything. I have a Rife device that I use on my kids, every few weeks or so, just to make sure, because they get so much exposure to, just random frequencies, right? But and my kids don't get sick.
Wow.
You know, and I actually undid a lot of the damages. My son had ADHD, which I don't see as a default or anything or a problem. But the way it was manifesting for a while, we were worried and didn't know that much. But then I just used the frequency devices on him, you know, a couple of years later. He's like a brand new person, you know.
Wow. Impressive.
So, yeah. So I've watched it work. Now, by the way, anybody out there with ADHD, I had ADHD before it was cool, right? Now everybody's got ADHD. but wait,
I got it.
It's one of the most. Yeah, there you go. It's one of the most beneficial things you can have because and this is actually studied. It shows the problem with ADHD, what they consider a problem, is people with ADHD. They don't focus on things that don't matter. So
that's a good point.
We spend all our energy talking about ideas, concepts, ways to improve the world instead of worried about how carefully we manage a checkbook or some, you know, arbitrary.
How to be politically correct, right?
If they don't call you, and then if they don't call you with ADHD, they'll add on bipolar or mania or whatever else they want to add on. You know?
Oh, I know. Well, now, I mean, it's a license to medicate is what it is, you know.
Yeah.
And I was very thorough. I thoroughly studied the medications when my son got diagnosed with because he was struggling a little bit, right?
Mm-hmm.
And so really went into it. I'm like, you know, it basically creates a pool of, you know, of hormones that are just kind of floating around there. You don't actually know what you're going to get. It's the same way all the antipsychotics work, you know. So like veterans come back from, you know, a horrifying experience where inevitably they were involved in something that was difficult to live through, right? I mean, if they're in active duty, they come back and what do they do with them? They have the buddy program. So the veterans go talk to other veterans who went through the same thing, right? But have no idea really how to get better, right?
Yeah.
Then they give them antipsychotics and then they provide therapy so they can relive their worst moments over and over and over again.
Awful.
Yeah. I mean, it's like, these things are all traps, you know. We have to teach people a better way. So I love you. You automatically won me over when you said doctor means teacher. I'm always telling you that. That's what doctors should be doing.
A good teacher motivates their students to learn the material and to kind of empower them to make better decisions in life and in their world. So, you know, truer than, yeah.
Well, Rachel, I know you, I suspect you have a pet because you are about it and I can tell, and I love that about you. So I did want to ask you though, what was the detox you were talking about? Now I've seen this, I've actually done one of these before where it was pulling the toxins down through the feet.
The foot bath?
Yeah.
Okay. So let's say you have a sick pet with skin problems, or a human, it's going to work the same way. You want to clean the gut. You know, you want to pull the metals out, like Doc said, chlorella. You want to, you know, you can do foot baths if you're a person. The foot baths it's an ionic foot bath. You've heard of those, right, Doc?
Yeah, and if you're a dog or an animal, don't call in. But go ahead.
I don't know about. We wouldn't put the dog in the foot bath, but for the pet, and then you know, what about diatomaceous earth, Doc, for pets?
Excellent for parasites, worms, fleas.
Food grade. Yeah, I use that on food grade level. Yeah.
Food grade, give to the pets because you want to clean out the parasites, the fungus, and any heavy metals that are in there. Same for person or pet. It's all the same. And then the laser homeopathic detox is basically finding whatever toxin it is, if it's mercury or Borrelia, and you'll take a remedy and you'll shine the light through it. But you have to go to ACIM Connect to get the training. But anyways, laser homeopathic, and you focus on that one toxin, it can come out. But like Doc said, you have to really be careful to have someone manage this vaccine detox process and remove things because there can be reactions.
Absolutely, yeah. Same when people remove metals from people's mouth. You know, people think removing mercury from people's mouths is like the answer, but if it's done wrong, you know, that's the worst thing.
More mercury in the body.
Yeah, absolutely.
Right.
Go ahead, Lisa.
And the diatomaceous earth, I want to say too, I used that when I had a rather large dog. It actually helps if you use it like in carpets if you have fleas. So it's a natural way to eliminate fleas
it's a desiccant. It dries out the
it dries out the fleas. So it's just a natural way to do that without giving that to your pet on their skin and the different things that they're opting into. So
some clients use borate base powders. There's a bunch of those. Borax.
But basically binders. You want to bind up the metal. You want to bind up the mold mycotoxins with the chlorella, with the diatomaceous earth, and charcoal. You know, for humans, the charcoal will come out and grab that stuff.
Yeah.
You know, I've worked a lot with these, a couple different versions of these frequency devices, right? And I actually was able to see, you know, in the frequency device, that actually does such a thorough body scan that you can identify exactly where you have deposits of heavy metals. Now, the only reason why you can identify it though, is because it's so dense. As long as you have proper nutrition, the body will break up everything, and then you'll have these leftover heavy metals that are very, minute, right? But they do break up, but man, it is tough. So yeah, I guess binders would be the only way to do it.
But you got to have nutrients first. Remember, the liver has phase 1 and phase 2 detox for people anyway, but same for pets. You got to prime the body with the proper nutrients. Otherwise, you're not going to be able to mobilize and move things around. So they've got to have their minerals and their vitamins and amino acids to transport all this stuff out.
Right.
And, let me add just, I don't want to, this is a whole other discussion, but because animals, like people who eat a lot of meat, and the ideal diet for an animal is a raw meat-based diet or a minimally processed diet. Because animals are feeding the holistic, processed, ideal diets, by their nature, raw meat and bones, if people are feeding the barf diet, that's one version. What's happening is you're also not only giving them good nutrients, you're giving them all the heavy metals that are in the bones of these cattle in this country. So you're getting them, they're already getting arsenic and mercury and lead and all those things. And so by nature, actually, you have to probably detox any animals on a raw meat diet even. So people say, wow, he's on a raw meat diet. That's great. And it is. But you also are getting the heavy metals and all the other toxins that are concentrated in the bones of some of those animals.
Because they're eating the GMO feed. I mean,
that's GMO, right. It's all one big,
that's the other thing is the GMO. Because remember, the GMO is inserting a fungus into the DNA of the corn and the
right. And so it goes all the way up, right, to the people at the top. Yeah.
Yeah. And I like the way you talked about it with homeopathy. I mean, you're really, if you feed an animal low frequency food, if you keep them in a low frequency environment, they've actually done studies to show it, because one of the ways I don't know if they still do this, but they used to take the cows, break their legs to stack them as close as possible when they went to slaughter. So now you've got all of these fields and fields of crying cows, right? Mm-hmm. That are with broken legs that can't move. And they would just come up and hit them with an air gun. And I always, I know this is true, even though, it's not accepted by traditional kind of science, but you have to realize that all the fear and pain that cow is going in, you're putting right into your body, and that is
the energy. Absolutely.
The emotional trauma stays with that pet or human, right?
Oh yeah, we see that. I see animals that have been affected by rabies vaccine that are more aggressive, bite other animals, and the animals that are bitten develop the symptoms chronically of what the first animal had. It could be more aggression. They talk about energy transfer. That's
yeah.
Well, yeah, because they'll put the disease in the animal. Like, this is like the bioengineering of it, right? Which is like not really talked about much, but this is how it works. They'll put the actual, the disease there, and then they'll put like some kind of neurological dampener, right? So you don't have the signs or symptoms of it, but you have the damage happening the whole time. But people don't respond. But what does happen is you have this kind of docile, minor kind of zombie character who's just kind of like, yeah, whatever, like all kind of emo and like, set, like that happens with pets, I'm sure. Yeah. Same way with
just like humans.
Kids now.
Right.
They want, this is exactly what they experimented on during World War II, right? Mm-hmm. They actually did this. They put out frequencies in a 440 frequency. They were giving them fluoride. So when they said, okay, guys, we haven't done anything for you so far. We haven't fed you. We've abused you, killed people in front of you, experimented on you. But guess what? Today you're going to get a shower. And they were like, okay, yeah, sure. Like, no, dude, it's not going to be a shower, right? Like, and that's how they got let into the gas chambers, right? Right? That's the exact same thing. And this is a scary part, but this is what they're doing now. It has always been the plan to control the lifespan, use us as an economic resource to take all the money. And this is happening now. They're trying to drain these accounts and stuff like that, right? Well, they were until about 2 days ago when the new key integrated monetary system kicked in. But this was their plan. Now everything has to change. It has to shift. And I think once people realize like the whole system has to be looked at holistically, just like the body,
Yeah. And we just have to keep pounding the drum, because I read something the other day, and I'm not a political guy, but this Adam Schiff is out to like avoid any vaccine, and getting all the filters and removing people. And, here is this political figure getting involved in healthcare issues. It's dangerous stuff. I mean, it really is. They're trying to censor everybody and everything. They don't want information. you know, they just want to give you the skewed stuff. It's very frightening, guys.
Mainly, this is what happens. Adam Schiff brings in for the impeachment hearing, and they all sit around, and they're like, it's like a bunch of actors, right? And they're all practicing, like, okay, who wants to be really angry at what they found out? Okay, you do that. And they come out and they're like, I cannot believe this happened. And they act it out, right? Like Adam Schiff is like really dramatic and flamboyant when he's not actually playing the role of, you know, a corrupt politician.
No, but I mean, he's out to like get rid of like the vaccine awareness is what I'm saying, whatever his connection is on that. But him particularly, I saw that. I'm like, oh my God, what's this? You know, I don't really get involved with the politics, but when I saw that, I could, you know, it shows you what we're up against. That kind of.
Zuckerberg is trying to censor the whole thing. So anything about vaccines, the CDC thing will automatically pop up on your Facebook post. If you talk about vaccine, it knows.
Yeah.
And Google has intentionally buried it. We actually had that on our news here I'm at a couple months ago, that Google, for our own safety, is going to bury anything having to do with non-vaccinations or health issues, because they want you to see what they want you to see, right? And so that's Google, Facebook, any type of even Twitter, any type of social media. They're burying it all intentionally.
They sure are.
Yeah, thank God we have homicidal maniacs who are making decisions about what's best for us, because that makes me feel warm and fuzzy inside. I feel great about that. So listen, thank you both so much for coming on today. Dr. Dym, please, I'd love to, you know, do some segments and, you know, just promote you a little bit.
Sure.
Your website that I can send people to?
Yeah, my website is drdym.com. It's easy. DOCTORDYM as in Mary, all one word, drdym.com. That has all my information.
Dr. Dym.
We're going to post that information below this video when we send it, as well as the rabieschallengefund.org. I think that's the correct name, right?
rabieschallengefund.org. Check out the states that allow medical exemptions after the first year.
Thank you, Doctor. We really appreciate you being on. And Rachel as well. Thank you for connecting this and being on with us as well.
Thank you, Rachel.
All right, guys. We'll talk later.
Have a great day.
Talk later. All right. Be well. Okay. Bye.
You too.